In the West African zone, Nigeria is the only country that has not embarked on preventive mass campaign on yellow fever. Although yellow fever has been introduced into routine immunization, but the coverage is not enough. 23 million Nigerian children are estimated to be at risk of yellow fever because of low coverage of vaccination. The current outbreak of yellow fever in some African countries prompted the discussion of Nigeria's preparedness at this forum.
As long as we're having cases in Angola, in DR Congo, we never knew it would go to a place like China or even to Kenya. China and Kenya were able to stop it because they were prepared. Because they were prepared for the so we need to be prepared in case one or two Nigerians come from all those places. You may ask me where it's been going on, why have they not come? We can't determine when they are coming.
Support for local production of vaccines was mentioned as important to sustaining immunization strategy in the country.
The issue of local production of vaccine is a fundamental public health security issue. The private sector is ready to come in and make investments, but government buys more than 95% of vaccines that are used in Nigeria, and no private sector company would invest if there is no guarantee that government will take off these products when they are manufactured.
The laboratories that will do the diagnosis, the good disease surveillance to detect if it's occurring, we don't have it. And until that's the first step. If you don't get that in place, you won't even know you have the problem. I mean, remember when Lassa came, it dragged on for so many months before the lab confirmed it. And the luck we had with Ebola was the fact that there was a lab that did a quick diagnosis. Without it, it would have been a problem.
The last yellow fever outbreak in Nigeria happened more than a decade ago. Yellow fever is an acute viral hemorrhagic disease and is transmitted by infected mosquitoes. Symptoms of yellow fever include fever, headache, muscle pain, jaundice, nausea, vomiting, and fatigue. Vivian Irikefe, TVC News.